Clean drinking water is, of course, a big issue in the 5th Congressional District, but it's a big concern for most Kentuckians that their neighbors have clean drinking water and food. So, Mr. Hicks, your response to the same question.
Yes, ma'am. Well, the first thing we have to do is take a look at how we got here. And whether it is Maxey Flats out on the edge of Fleming County and the hazardous waste that was put there, or whether it's the much more recent dumping in Estill County. Both of these are within this district. Both of these affect the groundwater of this district. So first of all, we've had corporate bad actors come in here and poison our communities. We have to hold them accountable first and foremost and send the message that this is not okay anymore. You can't come to Powell County or Fleming County or Estill County and dump your waste and leave us to deal with it while you take the profit. We have to stop that. The second thing we do is I think the infrastructure piece of this. In Martin County, the coal sludge that poisoned that water, it poisoned the groundwater because the infrastructure is not there. Those pipes leak and it's infiltrated that system. We have to make sure that's not happening everywhere else. We have to make sure that our infrastructure is good. Western Fleming County Water District that my dad sits on are struggling to figure out how are they going to provide service to the new elementary school in Ewing. How are they going to do these things and make it so that people have clean drinking water? The only answer is infrastructure projects. That's it. That's the only answer. We need the infrastructure in place. And then we enforce, again, the laws against those bad actors that feel free to come in here and dump in Kentucky, to come in here and poison our water and our land because they don't think we're going to stand up and fight back, because we haven't had someone in Congress, not from the 6th District, standing up and saying no more. We're not going to accept this in Kentucky anymore. We're not going to poison our communities and our children for your profit. I intend to do exactly that.
Carolyn Dennis from Georgetown, Scott County, asks and says, as a retired public health employee, I'm concerned about funds for our health departments being decimated when our services are more vital than ever. How would you address this funding crisis? And Mr. Hicks, perhaps some would say that one of the issues that's been most revealing during this COVID-19 outbreak is the importance of public health. So your response to Ms. Carolyn Dennis?
Well, first of all, I agree 100%. This has really brought to the forefront that our public health administration, our public health department, it plays a crucial role. As we've seen the infection rates here in Kentucky low because of good actions by citizens, because of leadership from the governor, we still know we have a tremendous problem. And our public health services are underfunded. I know, I've talked to some of them. They don't feel like they have the tools in their toolbox to address this crisis, but more importantly, how do we set them up better for the next crisis? And the only answer is funding. We have to fund it appropriately. This is our public health. It's named aptly. This is our public health, and we all experience public health in the same environment because we all live and work and play and are together and live here. And so public health has to be a concern. We have to fund it appropriately. We have to staff it appropriately. Contact tracing is going to be the only way, absent of a vaccine for this virus, that we're able to get back to work again. And we can't contact trace if our public health department is running on a shoestring budget and barely keeping people employed. That seems like a tremendous injustice here in Kentucky, where we have comorbidities, where we have problems with diabetes, where we have tobacco use higher, where we have cancer incidence higher. It seems like a tremendous injustice. The funding needs to be there so that the public health professionals can help guide us through this crisis and guide us through the next and keep us all much safer than we otherwise would be.